In this video by Deck Plate we will be discussing ankle conditions. Some of the most common ankle conditions experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Ankle conditions mostly diagnosed in veterans during military service. Veterans go through rigorous training and physical demands during active duty or active duty for training, which includes frequently carrying heavy gear for long periods of time. So, ankle conditions are common and they can lead to the development of other issues such as disabilities of the feet and of the knees. So, today, we will be breaking down some common ankle conditions that we see in veterans. Achilles tendon rupture. Achilles tendon rupture is an injury that affects the back of your lower leg. It mainly occurs in people playing recreational sports, but it can happen to anyone. The Achilles tendon is a strong fibrous cord that connects the muscles in the back of your calf to your heel bone. If you overstretch your Achilles tendon, it can tear, rupture, completely or just partially. If your Achilles tendon ruptures, you might hear a pop, followed by an immediate sharp pain in the back of your ankle and lower leg that is likely to affect your ability to walk properly. Causes of Achilles tendon rupture. Your Achilles tendon helps you point your foot downward, rise on your toes and push off your foot as you walk. You rely on it virtually every time you walk and move your foot. Rupture usually occurs in the section of the tendon situated within 2.5 inches, about 6 centimeters, of the point where it attaches to the heel bone. This section might be prone to rupture because blood flow is poor, which also can impair its ability to heal. Ruptures often are caused by a sudden increase in the stress on your Achilles tendon. Common examples include increasing the intensity of sports participation, especially in sports that involve jumping, falling from a height, stepping into a hole. Symptoms of Achilles tendon rupture. Although it's possible to have no signs or symptoms with an Achilles tendon rupture, most people have the feeling of having been kicked in the calf, pain, possibly severe, and swelling near the heel, an inability to bend the foot downward or push off the injured leg when walking, an inability to stand on the toes on the injured leg, a popping or snapping sound when the injury occurs. Diagnosis of Achilles tendon rupture. During the physical exam, your doctor will inspect your lower leg for tenderness and swelling. Your doctor might be able to feel a gap in your tendon if it has ruptured completely. The doctor might ask you to kneel on a chair or lie on your stomach with your feet hanging over the end of the exam table. He or she might then squeeze your calf muscle to see if your foot will automatically flex. If it doesn't, you probably have ruptured your Achilles tendon. If there's a question about the extent of your Achilles tendon injury, whether it's completely or only partially ruptured, your doctor might order an ultrasound or MRI scan. These painless procedures create images of the tissues of your body. Ankle arthritis. Ankle arthritis occurs when there is a breakdown of cartilage in the ankle joint. It can result from a variety of causes, including trauma, such as a car accident, autoimmune diseases, such as rheumatoid arthritis, or infection. In most cases, ankle arthritis is due to the degeneration of the cartilage from an old injury. Ankle arthritis symptoms. Pain that may increase with activity, stiffness or loss of mobility, swelling, deformity of the ankle. Risk factors for arthritis. You are at an increased risk for arthritis if you are over 65 years old, a woman, obese or overweight. Family history increases your risk of osteoarthritis. Ankle arthritis diagnosis. So we can understand your condition, during your office visit, we will take a complete history and conduct a physical examination to assess skin changes, the presence or absence of pulses and nerve sensations, the range of motion in your ankle, and the areas of discomfort. We will take x-rays to evaluate your degree of arthritis and any associated ankle problem. We may order further testing, such as a CT scan or MRI if we are considering surgery as an option. Ankle arthritis treatments. Your individualized treatment plan is based on any previous treatments you have had, your current level of disability, the presence of other medical conditions, and our findings from your health history, exam and x-rays. Non-surgical treatments. We always look at non-surgical treatments first, especially if you have never received any other treatments. Treatments can include ankle bracing. Either a custom-made or prefabricated ankle brace will stabilize your ankle joint and provide support for your ankle. Cortisone injections. Cortisone injected into the ankle can reduce pain and swelling during a flare-up. Activity modifications. Limiting high-impact activities, such as running, jumping or court sports, or switching out high-impact activities for low-impact options may be an option for you. Ice and anti-inflammatory medications. We may give you these as needed to decrease symptoms. Surgery. Surgery is only considered if all appropriate non-surgery treatments have failed. The types of surgeries we do include ankle fusion, arthrodesis. This procedure can be done either inpatient or outpatient, depending on your condition. Ankle fusion fuses together the two bones that make up the ankle joint, the tibia and talus, to make one solid block of bone. Fusion is an excellent pain relieving procedure for arthritic joints. It involves removing the cartilage from a joint so it grows into one bone, eliminating the pain of bones rubbing against each other. Fusion of the ankle does result in loss of approximately 75% of ankle motion, but some motion is kept through the joints underneath the ankle and into the midfoot. Total ankle joint replacement, arthroplasty. This ankle joint replacement treatment utilizes the newest implants, prosthesis, available. The surgery is only appropriate for certain patients with ankle arthritis, but for the right candidate, it can be very successful in preserving function and providing excellent pain relief. We are one of the few healthcare providers to offer total ankle replacement to our patients, and our surgeons are highly experienced in this procedure. Bone spur removal, debridement. Arthritis can cause bone spurs to develop on the ankle joint, and removal of these bone spurs, either through an open ankle incision or through an ankle scope, arthroscopy, may relieve pain and improve range of motion. Distraction arthroplasty. This is a new joint restoration technique that uses an external frame, applied surgically, placed around the outside of the leg to spread the surfaces of the ankle joint, to encourage new cartilage growth. This procedure maintains ankle motion and relieves pain. Ankle gout. Gout is a type of inflammatory arthritis, a condition in which the immune system has a strong reaction, attacks otherwise healthy joints, and leads to inflammation. When gout symptoms like intense pain and swelling develop, it's known as a gout flare. These flares can last from days to weeks and usually affect one joint at a time. When a gout flare affects the ankle, it is known as ankle gout. Causes of gout in the ankle. The underlying cause of gout in the ankle is the same as gout in other joints. Gout occurs when excess uric acid, a waste product of your metabolic process, builds up at a joint and triggers inflammation. During metabolism, your body produces uric acid after breaking down organic compounds called purines. Purines are found in the body and in purine-rich foods, like red meat and some seafood. Usually, the body transports uric acid from the bloodstream to the kidneys, discarding it in urine. But at times, hyperuricemia can occur. This is a condition when there is too much uric acid in the bloodstream, either from a high purine diet or because the kidneys aren't removing the acid properly. Not all cases of hyperuricemia lead to gout, but some people with hyperuricemia can develop gout when uric acid crystals build up at specific sites in the body. Gout in the ankle occurs when uric acid crystals become lodged in the ankle. This leads to swelling, redness, and sudden, intense pain. Symptoms of ankle gout. Gout in the ankle can sometimes be difficult to identify. It's easy to confuse it with an ankle sprain or strain. But unlike ankle injuries, gout in the ankle occurs without a prior wound. It also comes on quickly. The main symptoms of ankle gout include intense pain, redness, swelling, heat. Diagnosis of gout in the ankle joints. Visit a healthcare provider if you suspect that you have gout in the ankle. A primary healthcare provider will likely refer you to a rheumatologist, a doctor who specializes in inflammatory diseases, for diagnosis and treatment. A provider may use the following tools when diagnosing gout in the ankle. Physical exam, to examine the ankle joint and rule out other possible causes of the pain and swelling. Medical history, to learn about your family history and health risk factors associated with gout. Blood test, to detect elevated levels of uric acid in the blood. Joint fluid analysis, to check the joint fluid for uric acid crystals. Ultrasound, X-rays, or other imaging tests, to look for uric acid buildup in the joint. Ankle bursitis. Ankle bursitis is when one or more of the bursae in the ankle become inflamed or irritated due to overuse or injury. When the bursae in the ankle become irritated or inflamed, it can cause pain, swelling, and difficulty moving the ankle. Causes of ankle bursitis. There are several common causes of ankle bursitis, including overuse or repetitive motion of the ankle joint, common in runners or dancers, can irritate the bursae and cause inflammation. Trauma to the ankle, such as from a fall or injury, can damage the bursae and lead to inflammation. Infection in the bursae, although rare, can cause ankle bursitis. Medical conditions. Certain medical conditions, such as gout or rheumatoid arthritis, can increase the risk of developing ankle bursitis. Inappropriate footwear, wearing poorly fitting shoes that put pressure on the ankle can also contribute to developing ankle bursitis. Symptoms of ankle bursitis. Common symptoms of ankle bursitis include pain and tenderness in the ankle, swelling or a lump in the ankle, stiffness or difficulty moving the ankle, warmth or redness around the affected area, aching or throbbing in the ankle, especially when a person applies pressure. These symptoms can vary in severity depending on the cause and extent of the inflammation. Diagnosis of ankle bursitis. To diagnose ankle bursitis, a healthcare professional will typically examine the ankle and ask about a person's symptoms and medical history. During the exam, doctors may press gently on the affected area to check for tenderness, swelling, or warmth. In some cases, doctors may also order imaging tests, such as an X-ray or MRI, to rule out other conditions and assess the extent of the inflammation. If a doctor suspects that an infection is causing bursitis, They may also order a fluid sample from the bursa to test for bacteria or other pathogens. Once the doctor confirms a diagnosis of ankle bursitis, they will develop a treatment plan tailored to the individual's specific needs. If you were discharged veteran from U.S. military and looking for the compensation you can get for the ankle conditions, please check out our other video on ankle conditions with compensation rating. Thank you for watching our video. Please don't forget to subscribe and like our videos.